Hi, in today's video we are going to learn how to take a preclinical primary impression, and for that we required Armamentariums, and you don't need so many things. You just have to buy one denta box and the whole year one is sorted for you. So it is the male student. For female students we have many design like crochet and so many Pinterestian girly things. Let's start by Armamentarium. Let's start with maxillary impression first. So here is the maxillary cast and it is the mandibular cast. Now it is the gauze piece which we have to put in the bowl. So when our impression compound softens, it's not stick to our bowl. Now we have to pour the hot water at 60 to 65 degrees Celsius temperature so that impression compound soften very easily and it will become easy to knead the impression compound. For maxillary impression, we have to require one complete cake of impression compound. Now we are breaking it into 3 to 4 pieces so that it is easy to soften. Now before moving to loading impression on the tray, let's understand which tray is required for the cast and according to which size which tray we have to use. As you can see, I am taking tray number 3 for maxilla. First understand there should be a 3 to 4 mm space is required for the impression material between the cast and the tray. Now here you can see the gap between the borders of the cast and the tray and the placement of the tray. Now similarly we have to do the in mandible also. You can see and appreciate the adaptation of the tray on the cast. Now we have to apply a separating media on the cast so that the removal of the impression is very easy. As we don't have a separating media, we have to use as a petroleum jelly, but we don't have, that's why I am using a Nivea cream. Sorry. Apply it on every border, every corner and every part of the cast carefully. Now we have to properly knead the impression material so that it is easy to manipulate and load on the tray. As you can see the consistency of the material here, how much it is easily manipulating.
This much consistency we require.
So first of all you have to take a primary Edentulous tray. Now we are taking it out from water and knead it again and build a small circular bowl, and then we have to put it on the tray and give a pre-shape of the border and the sulcus areas like here I am giving, as you can see. Then after that you have to lock the impression material on the tray on the frenum areas and the PPS area for maxilla, and for the mandible on the frenum area and retromolar pad area. As you can see how much easily I have created a borders or sulcus. See how I am going to lock the impression compound on the frenum and on the PPS area, so that it is not removed while we are taking out our impression on the cast. Now damp it again on water. Some of the water I have spilled out. Now we have to record the impression. So placement of the tray is like that. Before going to proceed, we have to see the frenum area, and on the frenum part only we have to press the frenum of the tray. Now mold the sulcus with your fingers. If it is impatient, we have to do a border molding, but it's not the patient, so we have to mold sulcus by our hand itself. You can see.
Ammar Impression.
Wait for some time. Then you just have to remove it.
It easily, but for that we have to wait for some time. Now wait for 2 to 3 minutes until the impression compound is set. Next step, for mandible we have to require 3/4 part of the impression compound. Put it on the hot water as previously we have done. Now apply the separating media on the mandibular cast also. As you can see, I am applying a Nivea cream because I don't have a petroleum jelly. Not this one because
I don't have a time. We can see.
Now it's time to remove the maxillary impression and to appreciate the borders and the impression which we have recorded. So here you can see it is very difficult to remove. You can use a carvers to remove it. Insert the carver at the PPS areas so that it is easy to remove. Now you can appreciate the borders, how it is beautifully it's recorded. After that you have to just cut out the excess like I am doing. I'm not going to cut all it, you have to do it by yourself, and your maxillary impression is done.
Prime impression for the maxilla.
Now let's record mandibular impression. Let's start with the mandibular primary impression. First we have to see the consistency of impression material, impression compound. So this much consistency we have required. Now properly knead it. As you can see, the consistency of the impression compound. Let's heat it again.
Also.
For mandible we have to roll it like this, and then again soften it. Now load it on the mandibular tray like this way. And then give it a shape of the mandibular ridge like this. And these are the sulcus areas which you are seeing. As in maxilla, we have locked the tray on the PPS area, and the frenum area we have to do in mandible also. Like this way, you have to lock at the frenum areas and the retromolar pad area, so that when material sets, it won't come out. Hit it again. Now let's record the mandible. So first we have to see the frenum and then place the tray. If there is a patient, we have to do the border molding. Borders are also. Like this way. We can now soften it with this also, like this. If you have to record this side properly, put this in hot water, record it again. Now wait for some time. You can see after removal of the impression, you have to cut this all down. Just you have to left with the border like this. You can see. Wait for some time. Let the material to set. Now we can take it out. As I mentioned already. See what we have to do in this now. We have to cut all these areas. Then tempt it in water again, hot water. All this part we have to cut down in the blade. See, you can see the tray exposure here and here again. So what we have to do, before taking impression, we have to bend the tray on the outer side so that impression material can take place there. Okay, now we are done with the impression of the primary cast and the preliminary cast which we are showing, and after that we have the first and the most important work to clean are the desk and the areas where we are working. So let's do this too.
You can use this again. So pour the water and use it again.
In last, we have to say something about that. You can see this is the beautiful box which we have created, and soon I will be launching on my website. You can visit www.dentahub.in. In August we are launching this DentaHub for year 1. So please go visit and subscribe our channel, and please do watch my next videos and follow my Instagram also, dentahub.in. Thank you.